All right, good morning, everyone. It is 10 a.m., so I want us to get started. My name is Malaya Florendo, and I'm the trainer with RxSafe Del Norte. I do want to welcome everyone to the third week of the Wellness and Recovery series. We're about halfway through, and we're really excited to have you all here today for our first presentation of the third week. Today, I want to welcome you to the workshop, Opioid Prescribing and Pain Management the PHC Way. And we are joined by our presenter, Dr. Jeff Ribordy. Jeff Ribordy has been the Regional Medical Director for Humboldt and Del Norte counties at Partnership HealthPlan since June 2013, and Whole Child Medical Director since January 2019. And he'll be presenting today on the benefits and process of Partnership HealthPlan California. So thank you for being here, Jeff. Do you want to introduce yourself?
Thank you. This is, as she said, my name is Jeff Ribordy. I've been at Partnership since 2013, and I've been a provider in and still live in Humboldt County since 1998. I really appreciate you having me here and letting me have an opportunity to talk about Partnership and kind of the work that we've done around the opiate crisis. I always have a hard time coming up with the, titles for these talks. And so I just, threw that title out there with the PHC way, but I do want to emphasize that, these aren't our ideas and we didn't create the guidelines, but we use all the, national and state guidelines that, make sense or evidence-based, and really work in collaboration with community partners, physician leaders, community leaders, public health departments in our areas of service. We serve 14 counties in Northern California. For those of us who don't know us too well, mixture of rural up here and more urban counties down in the northern part of the state. So as we all know, we're really the true Northern California. So let me share.
Oh, before we get started, do you mind if I go through some group agreements?
Oh, yes, go ahead. Sorry.
I'll circle right back to you. Thank you. Okay, so before we get started, I do want to recognize we have another presenter coming on later in the hour, Mr. Robert McAlonen, and he is a licensed clinical social worker and is Beacon's Director of Provider Quality in the West Region. And Robert has worked at Beacon for about 4 years and has clinical experience in community mental health clinics, substance abuse, intensive outpatient programs, and in private practice. Robert has a strong interest in the evolution of measurement-based care and mental health and innovations in whole person care. So he will be joining us later in this presentation, and I just want to remind everyone that he'll be on later. Thank you all for joining again. We do want to remind you, if you are in the Zoom, please keep yourselves muted and your video off out of respect for our presenters. We are live on Facebook, so we do want to remind everyone, of course, as always, that it is about a 45-second delay. So if you have any questions, it will take us a second to get to them. We do have people monitoring both the chat in the Zoom and the Facebook Live. So if you have any questions, please leave them in there and we'll get to them, and we'll have a section for questions towards the end of the presentation. So make sure to leave your questions in the chat and we will get right to them. Before we get started, as always, we want to go through a few group agreements. Always remember, respect and kindness are key. If you're not being respectful and it becomes a persistent issue, we will have to remove you. Please show tolerance and sensitivity for all differences. Participants in the group come from different cultural, racial, gender, and sexually oriented backgrounds. So please be aware and sensitive to judgmental comments. Please use positive language if you are going to leave comments, and stay away from using racial, homophobic, and degrading remarks, of course. this is a safe space and it is free of judgment. And so it's all right to disagree with someone else's point of view. However, we don't put each other down for it. This is a space where participants should feel comfortable to be themselves, share thoughts and ideas without any worry of punishment or judgment. If you are going to share stories, please remember to be careful with personal information and try and leave out other people's names. You can, for example, use "I know someone who ... because using name often aids in the spread of rumors and detracts from the point of the information trying to be communicated. So out of respect, try and not share names. We do ask for we do ask you to definitely ask for clarification from us. If you don't understand something, remember, you should feel comfortable. Don't be afraid to ask questions if you don't understand the information provided. Again, we will have people monitoring the chats both on Facebook Live and Zoom. So if you do have any questions, make sure to leave them in there and we'll try and get back to them as soon as possible. All right, well, thank you everyone for minding our group agreements. And we also want to remind everyone that as we have these conversations, sometimes it can be a heavy conversation for some people. So if it does bring up some feelings or concerns and you feel like you need to reach out to someone for your own mental health, there is the mental health Del Norte line here on the screen, as well as the 24-hour crisis services available. So remember, sometimes it can be a heavy talk for some people. So if you do feel like you need to reach out, don't be afraid to do that. As far as our informed consent and privacy, each person's participation in this presentation is voluntary, so please respect the privacy of others and do not share personal information with anyone else. This training is being recorded and may be live on social media. If you are participating via Zoom, please turn your video camera off and stay muted for those not presenting. And lastly, as always, we want to acknowledge the land that we're meeting on today, such as the Tallawed Dene, the Yurok, Kaduk, Hupa, Wiyot, and many rancherias such as Elk Valley, Resagini, Big Lagoon, Trinidad, Blue Lake, Table Bluff, and Ronerville. The indigenous people who lived together and cared for this land and each other since time immemorial. We honor with gratitude the land itself and the people who have been the stewards of this land for generations. We know the effects of colonization have impacted indigenous people disproportionately, and we hope that through this series we can learn together to help heal and work towards a healthy future. So wherever you are watching from, remember to acknowledge the land that you are on today. If you don't know, it's all right to go look for it. So find out where you're watching from today. So thank you everyone, and thank you, Jeff, for joining us today. I am going to hand it over to you.
Right. All right. All right. Can you hear me okay? I had a little change in sound.
Sounds great.
Okay, great. So, well, we already kind of talked about this. This is the mandatory introductory slide. So, so I want to give a kind of an overview of our program, which we called Managing Pain Safely. Well, we still call it Managing Pain Safely, and some historical perspective over the last few years. Some of these slides will look a little dated too, and I actually deliberately took them from a presentation that I did up in Del Norte a few years ago in 2017 when we were working with the community to create the opiate coalition. But it also, they actually give a good, like I said, historical perspective and a good transition to what's going on today. So as part of, well, let me start. When Partnership took over the northern communities, counties in September 2013 as part of the transition to Medi-Cal managed care. So Partnership is only, we're a nonprofit health plan. We only do Medi-Cal. And And when we enter into communities, we do change some of the things that may have been happening in the communities before. So one of the things that we do when when we've taken over counties, which these were the last counties we took over, was looking at the opiate prescribing and the formularies that had been previously available. And as we all know, those of us that have lived here for a long time, we know that opiate problems in California are a little more significant in the rural areas than in some of the urban areas, and particularly here in the north, most of the northern counties have had higher rates of opiate prescriptions and abuse and overdose rates than in other areas. So it was definitely more of a challenge when taking over in these communities and deciding what are the best ways to address that. So some of the immediate things that happened when we took over is changing the formularies. And having control over the formularies and the opiates and other prescriptions available is a very powerful tool. But as Ben Parker once said, with great power comes great responsibility. So you have to kind of use that power wisely and make sure that you're following evidence-based guidelines and real evidence when making those formulary changes. So some of our formulary changes are based on cost. We try to avoid brand names when generics are available. So one of the first changes that was made to the formulary was OxyContin, and everybody knows about OxyContin. Not only is it a brand name and expensive, but it's also highly abused, or it had been highly abused. And in fact, here in Humboldt County, there was a number of pharmacies that were actually robbed to specifically get at OxyContin, which caused some of them to stop carrying it. So that was a big change when we took that off the formulary. The program actually launched, the Managing Pain Safely program actually launched in January of 2014. A lot of the initial formulary changes happened in September when we took over, and then there's been changes going along through the years and stuff. So after looking at the formulary changes with the start of the program, there was also looking at the escalation of the doses, trying to keep members on a lower dose and trying to find alternatives to that. So removing some of the really high dose opiates, like there's a morphine pill that's 200 milligrams, which is already over the recommended level of use for non-cancer chronic pain. And I should say, this is really for non-cancer pain management for people with cancer and other severe, pain syndromes that, these guidelines don't necessarily apply. So we're just looking at non-cancer chronic pain treatment. So I should put that out there. So in October, there was a formulary enhancement where October 2014, where we wanted to get a statement from providers for members that were on high dose opiates but stable, and explaining, or at least some explanation, can they be transitioned to a lower dose. We are encouraging tapering plans for any patient on high dose opiates, but we weren't requiring it, and we never have actually required tapering plans, but we certainly were encouraging it and giving the providers the tools to help them with that. And then in April of 2015, we actually made some formulary changes to the opiates. At that point, the recommended maximum opiate level was 120 milligrams, or morphine equivalent dose milligrams per day. And if they were stable dose at that level or higher, then that was okay for 6 months, but then we wanted them to taper. We added a medication called duloxetine to the formulary, which many providers know that this is for another way to treat chronic pain, especially nerve pain. We made methadone non-formulary because we were finding that some providers were not as familiar with the dosing and were dosing it inappropriately. And methadone at high doses does have some significant side effects, like cardiac heart problems with heart arrhythmias and stuff. So we made some changes, and we also made alprazolam, which many people are probably more familiar with, is known as Xanax, because it's a medication that is not only highly prescribed and used, it's also highly abused. So we made that medication non-formulary to try and help transition to other options. And then we also added enhanced non-opiate therapies like chiropractic and acupuncture and podiatry and enhanced physical therapy benefits to that, so that we could have more options for non-opiate treatments. And then the program progressed to June 2016. At that point, we initiated TAR limits to we call quick acting or intermediate acting opiates. So these would be things like Norco and Percocet, things like that. We limited those to a maximum of 30 tablets in 90 days. To for acute use, that should be more than enough. This is obviously based on CDC guidelines, and also trying to limit members in getting into that chronic pathway. And then we started working in.
I didn't want, sorry to interrupt. I just wanted to make sure. Are you sharing your slides?
Oh.
I don't think we're seeing them. I'm sorry.
Oh.
There we go.
Oh, sorry about that.
No worries. Sorry.
I missed one button.
Thank you so much.
Okay, thank you. So yeah, here's the timeline I was talking about. This is the only slide I've been on so far. So so up to July 16 to June 17, we started working on what we called our sustainability plan, and that what we were seeing is significant decreases in all the measures and stuff, and I'll talk about that at the end, share the data that we have. And by July of 17, we implemented our sustainability plan, which basically meant that we met a lot of our goals in terms of reduction, and that we would continue to monitor the individual counties and areas. And if we saw an uptick in opiate prescribing or numbers of morphine equivalents going up, then we would reinitiate the program for those areas. So that was 3 years ago, and in that time, we have not had to reinitiate any of the programs because all of the measures have continued to improve, and and that's really because of our providers and our network that are more familiar and more educated on how to treat these issues and stuff. So, and once again, we'll talk a little bit about that. Well, I'll show you the data later. Nope. Now I got to make sure I'm on the. All right. So this just, it's kind of a busy slide, but it just gives you an idea of all the different factors and people involved in creating these community stakeholder groups, the guidelines, a lot of meetings that were happening around creating this program. On the partnership side, almost I think pretty much every department, from care coordination to pharmacy to our provider reps and things like that were involved in this development. We had a steering committee, and then using regional medical directors like myself to interface with the community. We had a lot of community events and talks around this topic, and then all the community stakeholders, the PCPs, the specialists, the emergency room doctors, pharmacists, advocates. Many of our community work groups have advocates and people that work in the community or have had issues themselves, and are bringing that perspective to the table. The one group that we hadn't had much success in connecting with is dentists. Dentists do prescribe opiates for pain control and stuff, but in most of our communities, we have not been able to really interface much with those community dentists and stuff. So if anybody has any ideas about that, that would be great. But that's one area that we didn't have a lot of success in. So the other one down at the bottom, the law enforcement, is always nice to have them involved, because this impacts them, greatly. And in fact, Del Norte Coalition was really driven by the sheriff at the time, where he actually went and picked people up and brought them to the community meetings and stuff. So he was a big help in developing this, and the Del Norte community coalition has really taken off the last few years through management of the current people involved right now. So these are some of the things that we've kind of accomplished. Like I said, I mean, these aren't all our accomplishments. These are things that we worked with our community partners. But some of these are internal programs that we created. This program called Outreach and Understanding Can Help program, or aptly named OUCH program, is a program inside our care coordination department, where our care coordination people that work in that department, it's kind of an outreach program to interact with members with chronic pain issues and how we can help them. We implemented a lot of not only formulary changes, but prior authorization changes, but mostly around the pharmacy. We added incentives to our program for quality. Is called Quality Improvement Program. So we have quality improvement programs for PCPs, pharmacists, hospitals, a lot of them, but most of the ones around the opiates were for the pharmacy and the PCP QIP. So when you hear QIP, that's what I'm talking about. We set up a naloxone program, and we basically helping provider sites set up and for distribution. We helped fund purchase of about 2,000 of the nasal atomizers in the past to be just distributed for free. And I know a lot of other partners have done that as well. That's been a huge undertaking and very successful. We started a teleconsult pilot that providers, PCPs that maybe weren't comfortable or had a complicated patient could call and get a consult with a teleconsult with a pain management specialist. I'm not sure if that program is still in place, but if so, you can call our care coordination department and they can hook you up with that. We've offered to have a pain management oversight committee for those communities that don't have one. Same thing for complicated cases, for consults, ideas on how to treat differently or other ways. Our pharmacy department set up a pain management registry to kind of just basically to look at the numbers for the individual counties and areas, just to better understand the data. We have obviously a data analytics department at Partnership that is just amazing. They do, I don't even know where they get their data most of the time. They seem to be pulling it out of a magician's hat, but they get some very in-depth, detailed data that really helps us to develop these programs and stuff. So they deserve a lot of credit for that. And then, well, we already talked about the other enhanced offerings for treating pain. Some of the things we did in our QIP program for our providers, for our primary care providers, is that for newly credentialed buprenorphine providers who get their X waiver, we would give them a $500 incentive up to a maximum of 5 per site. And we also have that one we don't do anymore because essentially most of the providers, in fact, almost all the providers that are able to do this or are already X waivered. So there really aren't many prescribers that we haven't, or the communities haven't. Basically, it's not needed anymore because the community clinics have done such a good job of getting their providers qualified. The other thing we do still offer are peer-led support groups. These don't have to be around opiates. These could be around anything, but basically clinics that lend their sites to community members. These are community-run clinics, community-run groups that could be about diabetes, hypertension, substance issues and stuff. And then we pay the sites $1,000 per group per year for that, just to kind of encourage this thing, especially but around chronic pain management. But really, this can be about any kind of medical issue. And then some of the things we did for the pharmacists, the pharmacy QIP, is to have a measure around safe medication disposal. As you know, many pharmacies offer on-site medication disposal, but some are small or in areas where that's not really feasible. It's not the cheapest thing to do. So there's also programs that have the pharmacies can just have mail back envelopes for safe medication disposal, or there's some other things about certain powders and substances you can put in a bottle of pills and it'll just render the whole thing inert. But we provided an incentive for pharmacies to offer one of these kind of services. And then also a measure to allow the pharmacist to have a pain medication oversight, where they screen the patients for by using cures and other tools at their disposal, and have a kind of a screening plan that they would implement. And then some of the other resources we have is on our webpage, and I'll show you that in just a minute here, but we have a lot of, there's actually a lot of resources on there. We have a white paper about managing pain safely, about the program and a lot of the things that I'm talking about. We have resources for members. We have upcoming events, which we don't have anything scheduled right now, just because we're kind of in the cruising phase right now. And then materials and recordings from all the past events. We've had about 5 or 6 Managing Pain Safely conferences in the past, and all those recordings are on there. And then we have, we say PHC prescribing guidelines, but they're really based on the CDC and other states and communities that have come up with prescribing guidelines. But we have ones specifically for PCPs, we have ones for pharmacists, we have ones for ED, we have ones for even dentists. And then a lot of articles about prescribing, weaning, state guidelines, and I'll show you some of those. There's a link right there. If you go to our main page, there's a little tab up at the top that says providers, and it'll get you right to the Managing Pain Safely. And this is what it looks like. So broken down into the formulary. You can learn about the formulary changes and all the different things around that. The member resources, although I went in there, the member resources is a little skinny right now, but there is some stuff in there. And then we do have links for the community coalitions, although I see that on our site that Del Norte is not on there, so we need to add that on there. And then we have these different toolkits that are under the provider resources in the lower left. And then if you click on that where the arrow is, the view toolkits, resources, and guidelines, this is what it looks like. So we have a pharmacy toolkit, we have a naloxone toolkit, and a PCP toolkit. So those have a lot of, like for the PCPs, it has the screening tools, it has the pain assessments, it has sample contracts, things like that. So very useful if you're just starting out with this, or you want to kind of, change your whole program and stuff that, you don't have to recreate the wheel. So we also have the training resources. These are links to some of the talks. Couple of these talks, the art and very little science of tapering and rational and irrational use of opioids. These are done by Dr. Andrea Rubenstein, who's a pain management specialist for Kaiser down in, don't quote me on that, I think she's in Vallejo, but she's really a dynamic speaker, has done this for a long time and stuff, and very useful information. And that was from a couple of our conferences that we put on. There's a link for Project Echo, which is out of, well, actually different places have them. UC Davis has one, University of New Mexico, but it's a training program that connects with community clinics and educates around opiate prescribing, treatment, pain treatment, all these things it's a tele program with specialists from different sites. Like I said, New Mexico is this one. And so if you want to sign up for a Project Echo program, or at least your clinic, you could go there. So anyways, there's a lot of good resources there. There's a link there you see for past Managing Pain Safely events that'll take you to all the talks that we put on, and it has links for all the videos and recordings of that. Let's get to this one. And this is the rest of it. So as you can see, a lot of guidelines, the CDC being at the top is being, I think, what most people would refer to when we were first creating the guidelines. As you can see near the bottom, Southern Oregon was a little bit ahead of the game, as well as the state of Washington in prescribing guidelines and in trying to limit the amounts used. So those were used a lot in our initial guidelines. And then our dental guidelines are here: emergency department, community pharmacies, clinical guidelines for the use of buprenorphine. So a lot of good resources there. Once again, you don't have to try and recreate these. They're out there, and we're just trying to make them easier to find. And then some additional resources down there at the bottom. So there's a lot of information on there. So please access that if you need it. It's our website is completely open to the public. No issues. And then, so I talked a little bit about the sustainability plan earlier, and this is basically what we've kind of set it up for. So since June 2017, we've been in sustainability mode. The main part of it, well, the three main parts: monitoring the data. So we continually look at three measures. We look at the morphine equivalent dose per member per month. And this will make a little more sense when I show you the graphs. It's, for me, at least, it's easier to see in the graph form. The total members that are on opiates per member per month, and the total members on an unsafe dose per member per month. In our original plan, the unsafe dose is considered 120 morphine equivalents. It's now 90 based on CDC guidelines. So that's what we're monitoring this point. So we look at the data. If the data is showing, a reverse in trends going back up again in any of these measures, then the Managing Pain Safely program is reinitiated for that area. And like I said, we haven't had to do that in any of our areas yet. And the education piece is still there. Obviously, our website with all that information on it, still promoting any kind of educational events, Project Echoes, and in education around, from our medical directors. And we also include this information when we credential new providers. Obviously, it may have, fallen a little by the wayside at this point because everything is all COVID all the time now. But this is still an important factor, as you may have heard in some of your other talks and probably some upcoming ones, that mental health issues and overdose rates appear to be going up across the country as a lot of places are sheltering in place, and that has a significant impact on people's mental health. And then we try to continue to participate in community coalitions. Most of the ones in our area are still very active, and at this point, we're not encouraging new coalitions to form because all of our member counties have a coalition, but some are more active than others. So like I said, some of these slides are a little old. So this was back, right at the start of implementing the sustainability plan. And then what we've kind of not necessarily moved on to, but the thing that we've been working on a lot the last few years is our drug Medi-Cal benefit, which we call the health and wellness program. As you can see, this is on the slide from June of 2017. We were pretty much ready to go back then, and because of delays by the state and the federal government, it has just been implemented as of July 1st of this year. So there was a lot of delays in getting this ready. Unfortunately, a lot of the delays that we didn't have any control over, but it is in place now. So that will give enhanced medication-assisted treatment and other benefits as part of that program. So, and as I said, we continue to promote the UC Davis Project Echo and other Project Echoes as well. And then just a little brief talk about community coalitions. Once again, older slides. So at the time, 13 of our 14 PHC counties had an active county coalition. This was in 2017. And basically, this is a way for the community to get together and agree upon standards to use around opiates and controlled substances. And just bringing all the shareholders to the table and finding ways to work together instead of either working in silos or even at butting heads and stuff. So it's a good way to get the community towards a singular goal or goals. And well, I'll just leave that there. I mean, you guys at the time, Del Norte wasn't. Oh, I'm sorry, Del Norte got cut off there. Del Norte's the number one there. So at this time, most of the counties had a pretty robust coalitions, and Del Norte's was just starting, and Del Norte is, you guys have just taken off and have probably one of the more active coalitions at this point. Some of the other counties, even in some of our our larger counties like Solano and Yolo, their coalitions are not as active as some of the ones up here like Humboldt and Del Norte. So this is just same thing. Give you a historical perspective. This is the Humboldt. I was using this as an example when we were talking about Del Norte. The Humboldt coalition has a website with a lot of resources, kind of like our website. That's the link to the RX Safe Humboldt website, and then just a little bit about the history and the mission statement. This started back in 2013, about the time that Partnership came into the community. We didn't have anything to do with it. It was really driven by the IPA and St. Joe's and Open Door. And just the different work groups that they've had. Some of these are not as active now, like standards and guidelines are not that active because, the guidelines are pretty much, set at this point. So it's not a very active committee. Some of the other ones, like the Medication Assisted Treatment Committee, is obviously more active now. Naloxone distribution and marketing and public outreach, which is kind of an ongoing thing, getting the message out. The coalition received money from the California Healthcare Foundation. They were giving grants out to help with these coalition formations. I'm not positive, but I believe Del Norte might have as well. So, being a nerd, I always like to see the data, and it's kind of satisfying at times and stuff. So what we did when we were in the midst of the program is we decided to set goals. Always good to have goals. So by December 2016, we wanted to improve the health of our members, which is one of our mission statements, by ensuring that prescribed opiates are for appropriate indications at safe doses and in conjunction with other treatment modalities. So we wanted to hopefully see a decrease in the total number of initial prescriptions by 75%. So these are new starts, people that have never been on opiates before. So the goal of this is because a great number of people that start on opiates, somewhere up to 50%, even for only a few weeks, tend to progress into chronic opiate use. So if we can stop or decrease the amount of new opiate starts, then we can also stop a good number of the chronic opiates, and then try and find them other therapies that may be more appropriate or maybe just as useful. We wanted to decrease the total number of inappropriate prescription escalations by 90%. So this would be escalations, well, any escalation really, but especially above the limits which at this time was 120 milligrams morphine equivalent dose. And then also to decrease the total number of patients on inappropriate high doses by 75%, which was defined as greater than 120. So these were our goals. They were pretty lofty. We came up with these goals in 2014, and gave ourselves a couple years to try and reach these. Once again, in cooperation and working with our community partners. Our community partners are the ones doing all the work. We're just collecting the data. Other thing I'll say about our data is it is somewhat limited. Well, I wouldn't say it's limited, but it may not be as. It may look a little different sometimes from state data because we don't. A lot of our members end up paying cash for opiates, or like if they get them at the VA, we don't have access to those records. So this is based on our claim records. When we look at the graphs, they pretty much mirror the data that the state has, which is slightly different. So it's a good representation of the prescribing patterns in the different communities, but just to know that it's not exactly the same as maybe other data sources. So these are our outcome measures: total prescriptions, initial prescriptions, prescription escalations, and unsafe dose. And this is what we found. Our goal was by December 31st, and then we looked at the goals even as late as June, end of June 2017. So total prescriptions, we didn't have an initial goal defined, but at the time of the data, we saw almost 70% decrease. Initial prescriptions, we didn't quite meet the goal, but we were pretty close. We had 45% shooting for 50. And then the rate of chronic escalation, or basically the escalations, we wanted to see a 90% decrease, which is very, it's a lofty goal. But we almost got there. We got 80%, which is still a significant decrease. And then members on unsafe dose, we actually did meet that and exceeded it by a few percentage points. And the actual total number of morphine equivalent doses per 100 members per month, we didn't have a goal at the time, but we did see as well a significant decrease. And just to see that in graph form, you can see, it's nice to see them in graph forms. It's just easier to see. So we can see our total opioid prescriptions per member per month. We saw a 69% decrease. And then members on unsafe opiate doses. And this is actually, this is actually our more recent data. And this is plan-wide data. And I'll show you the county data in a minute, but this is across the partnership network. We saw basically 70% decrease in total number of opiate prescriptions, which is a significant decrease. Members on unsafe doses, we saw a almost 80% decrease. And then our MEDs. So basically, if you look at January of 2018, 1,200 MEDs per 100 members. That means every member was getting 12 morphine equivalent, 12 milligrams of morphine every day. So, and then down to close to 3 by April of this year and stuff. So a significant decrease in the amount of opiates that were being prescribed. And then this just gives you an idea across the counties. I mean, we saw decreases in every county. Some counties, I'm sorry, the names didn't show up, but right next to Del Norte is Humboldt, Lake, and then Lassen. Those are some of our, obviously our highest counties, Trinity, but as you can see across the board, significant decreases. The red is the 2017 data. So it made, the communities made a significant improvement in all of these measures. And then just another measure that we also had been looking at more recently is members that are co-prescribed both opiates and benzodiazepines like Xanax or other ones like that. It dramatically increases your risk of overdose and other side effects. And we saw a significant, 2/3 decrease in that as well. And then jumping into the county level data, this is all Del Norte data. This is our data, and I'm also going to show you data from the state dashboard. Like I said, the numbers aren't exactly the same, but the graphs are pretty much the same. So on the left there are the number of opioid users per 100 members per month. And this is from 2014 to 2017. So you can see a significant decrease there. And then the total MEDs from 1,255 per 100 members per month down to 415. And I circled the 415 because I want to show you the next slide. But you can see almost 70% decrease on unsafe dose and almost 70% as well on total MEDs. Now look at your 415 there, your circled number, and now look at the more recent data. The arrow shows you where that was. So up until the latest data we have, which is I think late 2020, overall we're seeing almost 87% decrease. But even since the last time we did this presentation, the data I had from 2017, still a significant decrease and continuing to drop. So once again, just really kudos to the community members and the prescribers in Del Norte, because and we are seeing this across all of our other counties as well, but just a continuing decrease in the amount of opiates. Now, this is data from the state dashboard. This dashboard is actually available to anyone. So you can go in there and, there's many different graphs that you can see and data you can see. I just picked out a couple just to give you the perspective as well. The one thing I will point out, and this is something that, we should once again emphasize about the community members, only about halfway through the graph. We came in late 2013. And so look at the 2014 line, go back to 2012 and, late 2011, you can see there were already decreases. That means there was already a concerted effort by providers and clinics to decrease opiate prescriptions long before Partnership ever came to town. So this is not, we're not tooting our horn. This is not because of us. This is because of the community providers that were taking this on and recognizing that this was a problem. We just were there to help, give them tools that they needed, support that they needed, and just try and make their jobs as easy as we can. So, but you can see the total opiate prescriptions, in the last, couple of years, this is through 2017, significant decline. And once again, this is the arrow from the end of that last slide, and continue just to drop off a significant amount. And this is just total opiate prescriptions and stuff. And then the other thing that, that doesn't always get talked about as much is buprenorphine prescriptions. Open Door has obviously been a leader, not just in our areas, but really in the state. If you go to the state dashboard and you look at the data for other counties, there's very little buprenorphine, or at least there had been, not at the times that Open Door started doing it, and then other community members have jumped in. So our buprenorphine prescription rates, especially per capita in Del Norte and Humboldt, are much higher than other counties. Our areas were kind of the leaders in this kind of therapy, and especially doing it as a just your primary care provider doing it. And you can see, a significant increase over the last few years. And once again, look at where the curve is in 2016, 2017, and, look where it is now. Continues to see an upward trend in buprenorphine prescriptions. So members are getting the treatment that they need. And, we hope that trend continues. So. And then this is also from the state dashboard. This was the really interesting data to me. So this is from 2016. This is opiate prescriptions by location, so by county, and you can see Humboldt and Del Norte are pretty close to the top. And this is the numbers there are the rates per 1,000 residents. So basically a little bit more than one prescription per resident in both Del Norte and Humboldt counties. But, we're not at the top, but we're not number one, but we are near the top of the list. The red down at the bottom is the California state average of all the counties. So as we knew, we've had a problem with the number of prescriptions and the amount of opioids being prescribed. And then the most recent data that they have is from 2018, and you can see in the numbers a significant decrease. Unfortunately, or fortunately, our spots in the state didn't change because everyone else obviously also made significant strides in reducing opiate prescriptions. So, we both, did well in terms of reducing the numbers. However, our standing, we're still on the higher end for the rest of the state. So still some work to do there. But this was the interesting part. So in 2016, Del Norte was the highest in terms of, they call it morphine equivalents. I'm sorry, I'm blanking on the other M. So basically it's the same thing as MEDs and just stating it a different way. So for every, basically Del Norte was the highest in the state of California at 1425 MMEs, when Humboldt was not far behind at 1070. So, very significant numbers. Once again, we see, Del Norte really dropped down to 749 and Humboldt down to 693, still at the higher ends. However, given all those opiates being prescribed in the community, it's interesting that the opiate-related overdose rates in Del Norte were half of Humboldt. So in 2016, Humboldt was #2 in the state in opiate-related deaths, and this is age-adjusted rate per capita. So it does take into account the small population size. But even though significantly more opiates were being prescribed in Del Norte, the overdose rate was a bit lower. Like I said, half. And actually, go to 2018. And Humboldt actually has made significant strides, actually cut the opioid overdose death rate in half. Look at, if you can see, it's at the bottom of my screen, Del Norte had no overdose deaths in 2018. So that's, I mean, that deserves significant kudos. I'm not sure what is different. I mean, obviously I know what's different between the counties, but something is going on different in Del Norte that is somewhat protective. So something, I don't know if anyone maybe in the chat or questions or anyone has some insight on that, but a significant difference, and always good to see on measures like this a 0, you know. So just some food for thought. And then this is some more recent data from our substance use disorder claims. These are, once again, these are based on our claim data, so it may not be a complete thing, but it gives you an idea of what is being treated and what kind of problems are. And you look in the middle there, and the most common substance being treated is opioids, followed closely by alcohol. Not too surprising, I think, to anybody who works in the community, that these are, you know, basically typically the 2 highest used substances in pretty much any county. Stimulants being the 3rd, so that's up there, and then the other really not a significant number for other classes. And then just a couple of things about the service location. You know, most of these are being done in an office setting. So office visits and office claims are by far the highest, with ER visits being a little bit behind there. And a significant number of this is being done in inpatient settings. So, which is something that in past years hadn't been done. So this seems to be a more recent change and stuff. So, and then of course, if you look at the last section on that, of course, the inpatient care is obviously going to be the most expensive. So certainly we want to encourage outpatient treatment if possible, but we don't want, if members are in the hospital, either for substance use or for another issue, if they can get treated at that time, you know, we want to try and do it whenever we have contact with the member. So, but that's just rough data that came from our health and wellness program. So, and then and this is just utilization data in terms of medication-assisted treatment. And you can just see, like, you know, kind of what we were seeing in the state dashboard is that treatment with any kind of treatment for medication-assisted treatment, utilization is going up every month. So, well, there's some monthly fluctuations, but that's pretty much all. Just the other thing I would say, you know, you can see that the majority of the prescriptions are coming from Del Norte. You know, they are the largest clinic in the area, but I want to just call out UIHS because they also have the second largest number of members, because it's split up into 2 or 3 different clinics there. So they are also treating you know, a significant number of members in the community. So, and they have a very robust program as well. So, and that's all I have. Like I said, it just wanted to talk about the data, talk about some of the things that Partnership have done over the years, and you know, we're always open and willing to help the communities and like I said, make things easier for providers and community members. So I think I will stop talking, and if anybody has any questions. And then let's see, let's stop my sharing.
Thank you so much. We really appreciate having you today.
Thank you.
Very informative workshop. I do want to just put it out there for those who are watching. If you have any questions, you're welcome to leave them in the chat, both on Facebook and on the Zoom. There is a 45-second delay roughly on the Facebook Live, so we'll try and get to your question as soon as possible, but make sure to leave them in the comments. But yeah, thank you so much.
Yeah.
Very, very informative.
And if questions come in later,
really appreciate it.
yeah, you can always send them to me and I can follow up with them. I'm happy to, whatever questions people have, or if more information is needed.
Awesome. Thank you. You really.
So I had a question in the chat. I'll go ahead and read it out. So we're still in need of ex-waivered providers in Del Norte County. We've had a hard time maintaining them or getting people encouraged to sign up. So what can we do to encourage more providers to get ex-waivered?
Yeah, that's an excellent question. I know there had been some turnover in the providers, especially at Open Door, and I know for a while there was very few options. I mean, I guess you could say in general, we could use some more providers in Del Norte County, which is always a challenge. Del Norte and Humboldt and some of our extremely, small rural counties have an ongoing challenge with not only recruiting providers, but keeping them in the community. So I think, as I mentioned, as part of our credentialing process, we give them information about opiate prescribing and about becoming ex-waivered and things like that. So, we certainly can encourage that and educate around that. We also have a provider recruitment program that we actually help clinics to recruit providers to the areas. And in fact, it's run by a gentleman named Cody Thompson in our Eureka office. The entire Partnership Network provider recruitment program is run out of Eureka. So those are the kind of things that we can help with. Certainly, if you find a provider, somebody finds a provider, we can hook them up with our recruitment program. We provide incentives to come here, to stay here, things like that. And then we certainly encourage them to get ex-waivered. And I think most of the clinics will actually help with that as well and stuff. So.
Thank you.
Mm-hmm.
Thank you.
And we do need a lot more providers here in Del Norte County.
Yeah, I know. Yep.
People don't want to live in this crazy rural community. I just don't understand.
Well, we've had some conversations around that with, my wife and my sons, and, I have one that lives rural, Magalia, and one that lives in Oakland and stuff. And, a lot of people are finding, or a lot of companies now are finding that, hey, they can actually work from home. They can do this job from home. And we have a friend who's a real estate agent here. And apparently people are coming from out of the area. They're looking for bigger homes that they can have a home office in and work from home. So, you can live anywhere. Yeah. Me personally, I'll avoid the traffic whenever I can. So.
Yeah, they could have a house on the beach for less than they pay in a larger community and work from there, right?
Where else can you get a coastal home in California?
Right.
Yeah, or that you can afford, I guess, yeah.
And then we had one more question. So you had a lot of really great data, and our coalitions locally up here in Del Norte, UIHS and the RxSafe would love to be able to get more regular data from you guys. How can we do that?
Yeah, I mean, certainly anybody could contact me and I can hook you up with either the pharmacy department or our analytics department. I'm not totally sure who's in charge of it. We had a person in charge of the program, but she moved on to other programs now. But probably the easiest thing would be just to have somebody get in contact with me and I'll get them the data. Yeah. Yeah.
Awesome. Thank you so much. Yeah, because it takes cures at least a year to get through, and it's very, so this is better.
And cures data is a little better because it's more complete. Like I said, ours, if a member pays cash, we don't get that data because all our data is based on claims records. So we can see cures, but it doesn't help with our data. So, but it's still very useful data. Yeah.
Yeah, very. Thank you.
Mm-hmm.
Awesome. Thank you. Is there any other questions people have? Well, if not, Jeff mentioned that he will have, we will find a way for you to get in contact with him. So if there are questions, we can send them to him later on if people want to ask any more questions later on today. So we'll make sure to get those to him if you end up thinking of a question, because I know there's a lot of information and it's all great and we're all still absorbing.
Yeah, you're always welcome to share my email too. That's not an issue.
Awesome. Well, thank you so much, Jeff. We really appreciate having you on today.
Thank you for having me.
I do want to welcome our other speaker who is now joining us, Robert McAlonen. Did I say that right? I'm sorry.
Hi, McAlonen.
Awesome. Well, thank you for being here today. We appreciate having you, and we just want to open it up for you to introduce yourself.
Great, thank you. So my name is Robert McAlonen. I'm the Director of Provider Quality at Beacon Health Options. So we work very closely with Partnership HealthPlan, and the way that that is structured is that we manage the mild to moderate mental health benefit, and in Northern California, the substance use benefit is still managed by the counties. So, however, I mean, Beacon is you know, pretty much all across the country, and so we have a lot of programs and resources for OUD specifically. So I wanted to share some of that today. So I'm going to walk through basically like some of the resources that are available to pretty much anyone. And a lot of that has been opened up as a result of COVID. I'm also going to touch on a few like COVID related things, just to kind of piggyback on the last comment with Jeff about access. Access is an issue pretty much everywhere across the board. But we have, in California, we've really, the past couple years, tried to focus on utilizing telehealth as much as possible. Obviously with COVID, it's pretty much forced all of our provider network, and I think most providers, regardless of the specialty, to shift to a telehealth pretty much only model. And even as we continue, or as we start kind of reopening and opening clinics, we're finding that the majority of our providers and the clients that are being seen are kind of leaning towards staying in the telehealth kind of virtual model. And that's for outpatient, that's for intensive outpatient programs, even some partial hospitalization programs, starting tele-MAT programs. So those kinds of things are, especially like tele-MAT and virtual IOP programs, those are very new, and you know, there aren't very many providers that were doing things like that pre-COVID. So we're going to continue to see more and more of that. And that's exciting because it does open up opportunities for someone in an area maybe where they have to drive really far, or there's just no access to a specialty program like that, that they can hop on a Zoom call like this and have a circle of participants that are all in treatment for the same reason, and have access from their living room. So it's, you know, it's both challenging times, but also a time of opportunity and growth, I think, in the healthcare field. So, so I'm going to share my screen with you all. And So I'm just going to go through a couple of resources, highlight a couple of things that I think you all will find interesting and hopefully useful. So essentially, if you go to the beaconhealthoptions.com website, this is what you see. And actually, this is what you see. And so the newest update is this red banner. We have a COVID specific resources for our members. When it says clients, that's referring to Beacon's clients. So those are our health plan partners, our employer partners, our military partners. So actually Partnership HealthPlan falls in that category. And then our provider network as well. You don't have to be linked to Beacon in any way to access this page or the resources. It's all open. So so I just want to start with the first kind of header up here, which is who we are. And so those of you that are not familiar with Beacon, we are serving 40 million people across 40 states. There's all the information here. We're actually centered in Boston, but we have a pretty large presence in California. I'm located in the Bay Area. I worked with a lot of our partnership providers over the past several years. Basically, I'll just say like our value or our kind of mission statement is we help people live their lives to the fullest potential. So information about kind of overall Beacon, if you're interested in those, that information. I want to touch on caring for our communities. This is really in response to the important issues right now around social injustice, racial inequality, and health disparities. So for many of you may or may not know, Beacon was acquired by Anthem earlier, end of last year now. Time flies. Early this year it was finalized, and so Anthem and Beacon both have really responded, I think, both to COVID and to issues around social injustice without hesitancy. And we have all kinds of resources, and we've done all kinds of outreach and webinars with our provider network to make sure that people are well informed as much as we can. So if you're checking out this page, we have some webinars around unconscious bias, raising children in respect to diversity, fostering inclusion in the workplace. So just lots of really good information, as well as information around the effects of kind of the trauma associated with the pandemic and the kind of violent events occurring. So really good information here for that. I don't want to spend too much time there. Go back to the main page here. The next thing I want to highlight is in regard to what we call Beacon Lens. And it's really our platform for educating the public on pretty much anything related to health and well-being. There are resources in here specific to SUD, but when you come into Beacon Lens, it is essentially all kinds of articles and resources, as well as our Twitter updates. So you can go through here. These are just sorted by most recent. And I'll touch on Echo just because it's here. Beacon is conducting Project Echo in several states around the country. We almost started Echo in California. It didn't work out. We have one in New York, Florida, Hawaii. I might be missing one. I think Connecticut. And so if you're not familiar with Project Echo, it was started in New Mexico around, I believe it was hepatitis treatment. And the reason they did that was because that people were traveling a really long way to find a specialist. And so the people in New Mexico, I think it's the university there, started the initial Project Echo, which brought in practices from all across the state to do kind of real-time consulting on a patient with an expert. So an example would be a PCP that maybe isn't super familiar treating X disease, can have this type of interaction, a video conference weekly, where they can sit down and talk about a specific case, de-identified for confidentiality reasons, but we're doing that in several states around OUD. So supporting maybe new prescribers with MAT, talking about best practices, sharing resources. So it's been really successful. It's very exciting. Maybe at some point we'll be able to expand that out to California. So that's what I want to say about Beacon Lens. Let me go back to, oh, here we go. I just want to touch real quickly on the COVID stuff because I think it's important. If you click on any of these resources, there are specific member resources. There's also webinars. So my department runs a weekly webinar on a lot of different subjects, most being somewhat tied to COVID. We're actually planning one in September around tele-MAT. So hoping that we can educate providers on where to get started with doing tele-MAT. Obviously there's going to be state-specific regulations, but really being able to open up access for patients seeking treatment for OUD, and how we can do that in a wider range that isn't necessarily tied to geography. So again, plenty of, I don't want to spend too much time on this portion, but plenty of resources for members. Providers, you're going to see a longer list of webinars here, and you can watch those by video or PowerPoint. All kinds of topics that we've done. This started in, I think, the middle of April, and will continue bi-weekly starting in August, and continue out probably for the rest of the year at least, depending on how long the need is there. I don't think there's anything else on here I wanted to touch base on. Okay. This is the next thing I want to show you all, I think is really useful, and I hope you'll take some time to check it out. But if you go to any of these links where there's members, clients, providers, caring through COVID, additional resources, if you click the drop down, there's this Psych Hub COVID-19 mental resources. And this is a, so Psych Hub is, my understanding of Psych Hub is that it's a conglomerate of healthcare payers in the country, most of the big ones that came together and said, let's create a platform where we can really try and provide useful information, free resources for the public, kind of a central point where people can get pretty much all the information they need. So you can read about PsychHub here. You can look at the learning solution, which kind of breaks down the levels. The main thing I wanted to show you was the video library. I think this is the most interesting part of this. All kinds of topics here. So you can click the drop down for, there we go, for topic. And you will see opioids here. So if you click on that, it's going to bring up, and this is, I think this is great for families of patients or patients themselves, because they're just very, I don't know, family friendly, I guess. Good videos for young people. It's a different way to communicate the information than giving someone a pamphlet or something. And I think watching a video sometimes is easier, especially for young people. So lots of really useful videos here around opioid. There's actually, I think, yeah, there's 3 different pages of videos. So, so lots of good resources there. I would definitely recommend that you all direct people to PsychHub. Another resource that I want to share outside of our Beacon page is Aunt Bertha. If you're not familiar with Aunt Bertha, it's just www.auntbertha.com. This is an incredible resource for our communities specific to the area where they are and what services are there. So I'll just type in an example here and show you. So this is what you'll see when you type in your zip code. It will bring up categories, and you can search for any of these many categories. So if you click on health, the first sub bullet here is addiction and recovery. And then there's like these sub bullets as well. So medications for addiction, outpatient treatment, residential treatment, sober living, just, 12-step programs. And this will tell you where you can access those in the community. My hope is that some of this will help access virtual programs as well. But again, Aunt Bertha is, we didn't have stuff like this before. And so I love what this offers people, and just one place where they can go and find out where they can get support. And for social determinants of health, this is, when you're talking about trying to support individuals in the community with social determinants of health, this is really the place where they can find those resources in one place and get connected. So one last thing I will talk about, and then I'm hoping that there's some questions or other comments, and I'm also available to be reached out to at any time, just if there's any interest here. So on this page, members can find a provider, and providers can become a provider with Beacon. So how to become a provider, there's portals for both of those. You just put in, like, find a provider, you put in your health plan, and then you can break that down by type of provider and specialty and all of that good stuff. For the last thing I'll say is another program that we have around OUD is called, it used to be called PDIP, it's now called RX Solve. And it's essentially a, the easiest way to describe it is an intervention system for providers and members. So if let's say a prescriber is diagnose someone with an OUD diagnosis and prescribing them also a benzo, there's a ton of different flags. So it'll flag someone if they're prescribed a medication and they also have a certain diagnosis. It'll also flag that provider if there's multiple prescribers seeing the same patient. There's also member feedback. So we call member, but patient feedback, where we'll send that person a letter with education information based on their diagnosis, based on the medications that they're prescribed. If they have multiple medications, there's specific literature that we send for that. So it's a great program to just kind of have a little bit of oversight and support of prescribers that are working with patients with OUD. And so I think that's it. As far as contacting Beacon, there's a lot of different ways to do it. Members can just click here, put in their information. So I'll actually just do this real quick. It doesn't take long. So we'll put in California, Partnership, English, or Spanish, submit, and then right here is, it says Partnership HealthPlan, but this is actually our phone number. So this will connect that person with member services to help them with whatever they're looking for a provider, if they're looking for resources, whatever that is. That number is here. The main Beacon number is at the bottom of the page, and that's also a way to connect to member services. I would always try to get people to call the local number here. So any questions or comments about any of this?
We do have a comment and a question, somewhat. One of our attendees or panel attendees on the Zoom asked, or she mentioned that Aunt Bertha is not very active in Del Norte, unfortunately.
Yeah, I was kind of thinking about that when I was saying it.
Yeah, and she's mentioned that they're building a resource guide locally. But she also was wondering if you can speak to why mental health services are an important part of addressing opioid use disorder and substance use disorder.
Yeah, I mean, we find that the majority of our patients have a co-occurring disorder, and so whether that's a medical, high blood pressure and depression, or a substance use and mental health diagnosis, it's rare that you find, someone that just has, one thing and you're treating that one thing. So we collaborate a lot with our county provider partners, because in California, the counties are responsible for the SMI population and SUD, and then where Beacon is involved, we are responsible for the mild to moderate. And so you have a lot of, no one fits into this, generally people don't fit into this, clear-cut box. So especially those that would fall kind of in the more moderate to severe type category, they they tend to need maybe a county level service. Maybe they go inpatient, then they go to the county for a little while, and then they're able to step down to one of our providers. We have a pretty good network in Northern California. I think we have a very strong network of providers, and we actually have strong access in most of the counties. Obviously less so in the more rural counties, but through telehealth, we really hope that we can do better. So I think the best way I'd answer that question is that, it's very, very common that the patients have both. And so coordination of care with our provider network, our PCP partners, and our county partners to make sure that we are integrating the kind of continuum of the treatment for that specific person is just incredibly critical. It would be a lot easier if we were kind of the one-stop shop for all of that, but that's not the way it's set up. And so, we have meetings with our county partners often, our clinical teams, our provider quality teams, to make sure that we have good, strong communication. And I think in Northern California, especially, for the most part, that's happening, and at this point happens fairly seamlessly. So hopefully that answers your question. But that's a good question, so thank you.
Wonderful. Well, thank you. We really appreciate having you on today. And for everyone watching, if you have any questions, please leave them in the comments on the Facebook Live or the comments here in the Zoom. We just want to say thank you again. And are there any last words you want to leave everyone with today?
No, again, I'm available. If there's questions, please reach out. Be happy to talk to anyone about any of this and what our focus and goals are for OUD specifically. And I'm available. So thank you for the time.
Thank you so much. We really appreciate it. And for everyone watching again, if you have any questions outside of the time of this video, both Robert and Jeff mentioned that we can get in contact with them with questions if you think of any later on. So make sure to leave them in the chat or contact us at Wellness and Recovery Series, and we can try and get you in contact with them so they can answer any questions you may have in the future. Well, thank you so much for being on, Robert. We appreciate having you today, as well as Jeff, Ribordy. Thank you for being on today. Wonderful presentations, both extremely informative and so many resources. We appreciate getting those resources out there. I think a lot of people, are always looking for that. So it's great to get, updates and your perspectives on it as well. So thank you for all the work that you do. Before we get off today, I do want to remind everyone of a couple of things before we get off. That we are the Wellness and Recovery Series. We are in our third week again, like I said. We are very happy to have you all. We've had some great engagement in the past few weeks, and we're really enjoying having all of our speakers and all of our guests be a part of it. And we thank you for registering on our Eventbrite and for taking the evaluations. We want to remind everyone watching, if you haven't registered for Eventbrite yet, please register. You can purchase a ticket. It is free, but you just go to the Wellness and Recovery Series.eventbrite.com to register through Eventbrite. Live presentations will be happening every Tuesday, Wednesday, and Thursday from June 30th to July 30th. Including speaker and panel series, videos, and activities, along with social media campaigns throughout the month. This series will be going out via Zoom and Facebook Live, so stay up to date and informed on our Eventbrite page. Again, we will be having raffles and some drawing challenges, so you can stay updated on that by registering at our Eventbrite or following the Wellness and Recovery Series Facebook page. As you can see, I'm wearing one of our Wellness and Recovery Series t-shirts today. You can get these, sorry about that. You can get these through our Eventbrite, as well as just staying engaged and participating in the events. The Eventbrite helps track who is participating so you can get your free t-shirt. Again, we are doing a couple of different fun activities, such as the Wellness Art Challenge. We had a little confusion. The deadline for this is actually July 27th. So you can download the PDF of the Wellness Art Challenge on the Wellness and Recovery Facebook page, or you can get it through our Eventbrite. So if you register, you can also get the PDF through there. Basically, for the art challenge, we're going to be doing what is your wellness activity? So we have a space open in the middle here on our graphic where you can put what your wellness activity is. You don't have to be an artist to participate. You can put a drawing, you can put a poem, a word, a picture, a video, like the possibilities are endless. So feel free to participate in whatever way that you're comfortable with. Let us know what your wellness activity is. We do ask that you take a picture or scan it in and upload it on social media and use the hashtags #HealthyDelNorte and #WellnessChallenge, or you can email it to us at rxsafedelnorte@gmail.com. Make sure to include your artist name and the age group. To be entered in the raffle for the Wellness Art Challenge, you got to make sure you scan them in or email them in or use our hashtags. We will be sharing the art, and each category will be eligible for an entry into a raffle for some awesome prizes. We are not judging what you're drawing. Again, every drawing or medium is eligible, so make sure to include those. Our age groups are going to be 0 to 5, 5 to 9, 10 to 14, 14 to 24, and 24 up is our adults category. So everyone is welcome to join in. Make sure to include your name and the age group again. The deadline is July 27th, and we'll be announcing winners on July 30th. As we are about halfway through, we do have a little update. We have successfully filled all of our slots, so we will be having workshops and panels and presentations every Tuesday, Wednesday, and Thursday until July 30th. So we do want to go over the calendar a little bit so you're updated on what's going to be coming up. Today, obviously, we have our opioid prescribing and pain management, the PHC way that we just did. And this afternoon, we're going to, at about 2:30, we're going to be going into a lived experience presentation with Philip Ross and Tonya Costa this afternoon. So make sure to join in on that. As always, our Wellness Wednesdays, we have the Eureka Health and Human Services presentations in the morning at 10 a.m. With Virginia Hedrick on July 15th. In the afternoon, we'll be doing some healing movement and with mindfulness and yoga with Alika Aird on the Wellness and Recovery Facebook page, as well as the Zoom. So make sure to register for Eventbrite to get all of the info on all of these. Thursday morning, we've got What is Pain, a presentation with Tim O'Connell. In the afternoon, we've got another lived experience panel with Yvonne Guido and some youth joining her. So make sure to get in on that. The 21st in the morning, we've got Katie Castle with UIHS doing a presentation. In the afternoon, we've got Robbie Laura doing a presentation also from UIHS. Wellness Wednesday on the 22nd, we've got the Eureka Health and Human Services. We'll be joined by Dr. Kishan Laura Cooper, amazing speaker, so make sure to join in on that. And in the afternoon, we'll have some self-massage techniques for pain with Stefania. On the 23rd, that Thursday in the morning, we have another Yurok Tribe Wellness Coalition Narcan training. So make sure to join in on that. Anyone can join, so you can get your certification and get your own Narcan. Everyone should be carrying Narcan. So in the afternoon, we've got an event that's not our event, but we are going to support and push it out there, is the Recovery Live, supporting families of adults who experience substance use disorder. So keep on the lookout for that. On the 28th, we've got some overview of programs with DHS for substance use disorder, overview of the Nitchin Resource Hub and Del Norte expansion with Patty Torres. And then we will be joined by the author, Shauna McCovey, who wrote the book Smokehouse Boys, a book of poems, and she'll be going over a poem that covers substance use disorder. And in the evening, we'll be doing a special presentation with Dr. Groves at 4:30. On the 29th, that last Wellness Wednesday, we'll be doing, in the morning, Yurok Health and Human Services will be joined by Boyd Ferris, and in the afternoon, we'll be doing 7-Kid movement, dance, and Pilates. And on our last day, July 30th, that Thursday, in the morning, we'll do one more Yurok Tribe Wellness Coalition Narcan training. So make sure you join those Narcan trainings, get in there, get your Narcan, get your certification. They're really fun and interesting, so make sure to join in on those. And in the afternoon, we'll finish up with our closeout event with the Wellness and Recovery Series planning team. We'll announce our raffle winners, the drawing challenge will be announced, and how to stay involved after all this. We will probably do some more presentations and activities in the future. The Wellness and Recovery Series is not limited. It may continue, so stay updated on what might be coming up and how to get involved. So again, sorry for the long spiel about the calendar, but we just want to make sure you're all updated on what's going to be happening for the rest of the month. We're really excited to have you all, and we appreciate your participation for the past 2 weeks. And as always, at the end of every presentation, always fill out our evaluation form. It has a few questions, try and answer them to the best of your ability, and make sure to get them in, because each evaluation form filled out is an entry into our raffle. The link for the evaluation form will be in the comments on the Facebook Lives, as well as here in the Zoom. So make sure to fill out these eval forms before you leave today. If you want to know some more information about the event, Wellness and Recovery Series, you can follow our Facebook page at the Wellness and Recovery Series. We also have Instagram as well on our RX Safe Del Norte. We have Facebook, RX Safe Del Norte, and you can also check out our rxsafedelnorte.org website if you would like to know more about that. So thank you everyone for joining us today. We really appreciate having you as always. My name is Malaya Florendo, trainer with RX Safe Del Norte. Thank you to our presenters for joining us today, and remember to fill out your eval forms. Everyone have a wonderful afternoon.